Most people in Florida look forward to autumn with the cooler temperatures. But if you're one of the 40 million Americans who suffer from fall allergies, this time of year can be less than pleasant. Here in Central Florida, fall allergy season usually starts during the last half of summer and lingers well into November or beyond due to global warming. Most fall allergies are caused by either ragweed pollen or mold spores because our weather provides for longer growing seasons. When ragweed pollen enters the nose and throat of people who are allergic to this particular pollen, it can cause bothersome symptoms including swollen and watery eyes, runny nose, sneezing, itchy throat, coughing, wheezing, and trouble breathing. It doesn't have to be that way though. Ed Neuzil, board certified nurse practitioner at Allergy Sinus and Asthma Family Health Center, explains that with proper precautions and the right allergy treatment, you can enjoy all the autumn has to offer.
If we know that allergies are a trigger and we know that the allergies are prevalent at this time, you try to reduce the amount of outdoor exposure if you can. And this isn't always something that people can do, but you try to avoid the trigger. Make sure you keep the windows and doors closed. There's no such thing as airing out the house. What you're doing is letting all the contaminants and pollens in the house. You need to keep the doors and windows closed. You need a good HEPA filter on your air conditioning. You have to practice the environmental modifications. You can't stay indoors all the time. Think about the fact that if the pollen's on the car, it's on the back porch, it's on the furniture, you've been outside for a while, it's on you. I don't care if you're sitting at a picnic and you don't even get sweat. The pollen's on you, you're dirty. And so in the evening time, you take those clothes, they have to go in the laundry. You need to get a shower, you need to rinse out the hair, you need to rinse out your eyes, rinse out your nose, because these are the areas where pollen can collect. Using a nasal spray to rinse the nose is something that you can do to rinse the nose, and definitely rinse out the hair, because we don't need the soap. We just need to rinse the pollen out, because when you go to bed, think about the fact all that pollen in your hair, you're now laying in the pollen for the entire night. So it makes a big difference. By just practicing some of these environmental modifications, you can greatly reduce your symptoms. For people that have more of a persistent symptoms for allergens, and we do check and we test for allergen triggers, the serum that we make up is specific for those individuals. They have their own vials, and this is actually a titration of everything they're allergic to. It's the actual pollens and stuff that's mixed up, is generally injected under the skin, and it's given on an increasing basis. So depending upon your severity, these injections would be given, and each time you would come in, you get a little bit more allergen until you got to what they call a maintenance level. And this is a level which was figured for you that's going to most benefit you without actually triggering symptoms. When we're giving allergy injections, I tell the patients that you shouldn't even feel any difference after the injection. If you're starting to notice nasal symptoms, any itching to the skin, any allergy reaction, it may be one of two things. It was either started too strong or we're advancing you too rapidly, and then we make adjustments accordingly. When it comes to the benefits of immunotherapy or any of the treatments, everybody's immune system is different. So I can't really tell somebody, oh yeah, you start the shots and a couple months later you're going to be fine. What the immunotherapy does is challenge the immune system to build antibodies. And so, are you still allergic? Yes, but your immune system is now strong enough to protect you from actually triggering those symptoms. So what's the difference between immunotherapy and maybe taking some medication? Well, when you take medications, you're covering up the symptoms. You still have the allergic reaction. So maybe your nose doesn't run, or maybe you don't itch, but you're still tired. You lack motivation, you just don't feel well, because you're already still having allergic reaction. Immunotherapy helps prevent that allergic reaction. And so there's a big difference between feeling good and just not having symptoms. And so immunotherapy in those cases works very well.
To get in touch with Ed Neuzil and the staff at the Allergy, Sinus and Asthma Family Health Center, please click our specialist directory or click on the Falling for Fall Allergies tab on our homepage, yourhometownhealth.com.